Good evening, everyone. Welcome to RSSDI Diabetes. Every year, we have thousands, if not lakhs, of people living with diabetes undergo amputations and thereafter leading a handicapped life. Thus, diabetic foot disease is one of the most dreaded complications of diabetes. RSSDI has undertaken a massive campaign, Save the Feet and Keep Walking, that aims to help create awareness regarding this as well as to help physicians test uh, using simple methods and help prevent further disease. We have a very interesting episode coming up today with the chief coordinators of the campaign, who are astute clinicians as well as experts of the field. But before that, let's play the video from our RSSDI National President, Dr. Kumar Sir, who is urging each one of you physicians to take part in this campaign. And if you are someone living with diabetes, please consult your physician and get your feet checked regularly. Tech team, can we have?
My dear friends, yesterday we launched Save the Feet campaign, and we have to put all our efforts in the next 30 days and make this a huge success by reaching out to all our patients with diabetes. We looked at a target of 1 lakh, but why not we do more than that number? So please register, visit the website rssdi.in and register and start checking the feet of our diabetic patients and make it a success. It's going to be a huge successful campaign of RSSDI to help our patients, to bring awareness, to avoid complications, and you register and inform all our colleagues to register and do this very successfully.
May I invite Dr. Vijay Viswanathan, sir, who is the Vice President of RSSDI and also the Chief Coordinator for Save the Feet and Keep Walking. He's the Chief Leader of this campaign. Sir, please invite our esteemed panelists and also take over.
So you're muted.
Can you hear now?
Yeah.
Yes,
we
sir.
can.
Somebody muted me. So we have two eminent panelists today to join me. We have Professor Rakesh Kumar Sahay, who is the president of the ESI and also an important member of the RSDA task force, diabetic foot task force. And we also have Dr. Ghanshyam Goyal, who is a renowned diabetologist and diabetic foot expert from Calcutta, and he's also a part of the diabetic RSDA diabetic foot task force. So thank you, Dr. Purvi, for organizing this meeting once again. I think the campaign is going on very well, and we'll talk about it a little later. My first point is diabetic foot, in my experience, is the most neglected and the most avoidable complication, if you ask me, of all the complications. But the one which is getting the least interest as far as research is concerned, research funding is concerned. So diabetic foot gets the least priority. So my first question to Dr. Ghanshyam Goyal is, why do you think people in India are getting diabetic foot problems in India, Dr. Ghanshyam?
Yeah. Thank you, Dr. Vijay. Thank you, Dr. Purvi and Dr. Rakesh. As it's a very pertinent question because we have got around 77 million diabetics in India, means we have to take care of more than 150 or 154 million feet. And biggest problem in our country is the our barefoot walking is one of the reason by which this diabetic foot problems occur. Then social issues, of course, lack of knowledge, poverty, literacy, and then the religious factors also, which are very important. because in our country, whenever we go to any temples or mosque or anything, we have to go barefoot. So that situation during hot summers or hot humid climate, we have got a burns. We see a lot of cases like that. And very important improper footwears, because most of our patients who are diabetic and they have got a loss of protective sensation, which Dr. Vijay is going to describe in detail regarding this campaign. So that is one of the very important issues. And very important, we have got even very minor ulcer or a just tribal injury, we take it very lightly. No, it's a very small thing. छोटी सी बात है, ये थोड़ा सा घाव हुआ है, it will be all right. Just like as it happens in other places of our body. So especially on the plantar surface, when it occurs, so that is a big problem. And so uh, lack of production of late presentation of the foot lesions is also one of the important aspect. Our patients present very late because they think it's a very small injury, minor travel injury, and they present late. So these are the problem. Then lack of podiatry services. You see, we have got a huge country, huge population. Around, we say that 140 crores of people, and still we have got not a single podiatric courses in the, especially the podiatry medicine courses of 4 years or 5 years are not there in the country. Very few courses, which is after the MS surgery, which is there in Chitra, in the Amrita Institute, Kochi, and other places. Very limited diabetic foot surgeons or persons who are interested in diabetic foot care are available. Then ignorance, lack of knowledge, which is very very important aspect, because people don't take it very seriously, and poor glycemic control. I think, Dr. Vijay, these are the important aspects and reasons why in our country we have got more number of diabetic foot cases. As you, yeah,
Yeah.
thank you.
Thank you, Dr. Ghanshyam. I think if you can ask the next question to Dr. Rakesh Kumar Sahay.
Yeah, Dr. Rakesh, I've got a question that can we diabetologist and endocrinologist prevent diabetic foot complications among the patients, and how it can be prevented?
Thank you. Thank you, Dr. Ghanshyam Goyal. Good evening to all those who have joined. I am sure a lot of people have joined this program today to know about this campaign that we've initiated from RSSDI. I thank RSSDI, the president of RSSDI who's just spoken here, for inviting me to be here, Dr. Purvi Chawla, for doing this program and inviting me today. So I would like to say that what Dr. Ghanshyam Goyal has said is a very pertinent question, that we have 70 million people with diabetes, and when we are speaking about diabetes, we are afraid about the complications of diabetes, whether it is the diabetic foot we are speaking of. Dr. Vijay has very rightly said that we forget to care about the feet. We look into the eyes, we look into the heart, we look into the to the kidney, and many times forget about the feet. But important thing is that all these complications are very much preventable. With good control of diabetes, we can prevent the complications. Not only good control of diabetes, also looking after the blood pressure and cholesterol levels, and all these things are very much preventable. So even if I have to say in Hindi also, I can say that, I mean, I would like to address all the audience who have joined कि डायबिटीज़ की वजह से होने वाले कॉम्प्लिकेशंस, यानी कि आंखों के कॉम्प्लिकेशन, यानी आंख की उनकी रोशनी इफेक्ट होती है डायबिटीज़ की वजह से, हार्ट अटैक्स होने के चांसेस बढ़ जाते हैं, और किडनी के प्रॉब्लम्स बढ़ जाते हैं. बट डायबिटीज़ के बारे से की वजह से पैरों पे भी असर पड़ता है. पैरों की सेंसेशन कम हो जाता है. सेंसेशन यानी कि पैर पैर सुन्नपन होना है, वो काफ़ी कॉमन है. और इस समय पर अपन अगर एक्शन बराबर लेते हैं, मतलब एजुकेशन बराबर होता है, पेशेंट्स को बताया जाता है कि ये सुनपने में जब उनको सुनपन है, तो दे हैव टू बी वेरी केयरफुल अबाउट देयर फीट. दे हैव टू सी दैट दे protect themselves from injuries, wear footwear always, be careful not only about not walking barefoot, but also when they cut their nails, they have to be very careful that they don't cut deeply and injure their feet. And then also when they are buying footwear, they have to be careful about seeing that they do not take a tight footwear and ill-fitting footwear. These are all the common things. These are common things which can lead to problems. And the most important thing is that we need to see that everybody with diabetes, every person with diabetes knows that his feet, he has to examine his feet every day, take care of his feet, see that his feet are protected, and that is going to actually see that he does not have any foot problems. And for this reason, we are from RSSDI initiating a very big campaign. Dr. Vijay Vishwan, we are very fortunate that Dr. Vijay Viswanathan is leading this campaign. He has been working in this direction for many years now. He has been dedicating all his life. He has dedicated towards preventing complications of diabetes, and particularly the foot is the most important thing that he has been working on. And he is also the president of the international organization called the DFoot, Diabetic Foot organization. Is a worldwide organization, and we are very proud that Dr. Vijay Viswanathan is currently the president of that, and he has initiated a very nice campaign to increase the awareness about diabetic foot problems. And I will now request him to tell us about this important campaign that we are starting. We are calling it the Save the Feet and Keep Walking, because this is a very important campaign of RSSDI, and I request him to enlighten us all about what made him think about this campaign, and how does he envisage that this campaign is going to make a difference to our people with diabetes.
Thank you, Dr. Sahay. Uh, the RSSDI is one of the largest organizations for diabetes in the world. We have about 21 state chapters from Tamil Nadu, Jharkhand, Chhattisgarh, everywhere. And we have close to 10,000 members in RSSDI. Last year, the RSSDI did a campaign called Defeat Diabetes, which was driven by our immediate past president, Dr. Banji Sabu. So this year is the 50th year of RSSDI. It's 50 years since this organization was started. And on the 50th year, we were thinking of what next to do. And we thought of the feet. And all the RSSDI EC members, Diabetic Foot Task Force members together called this campaign as the RSSDI Save the Feet and Keep Walking. Because only if you have feet, you can keep walking. Of course, you can walk with an artificial leg. That's a different matter. But with the two legs with which we were born, we should walk. And walking is very important for people with diabetes, exercise. So we want to cover in 1 month. We started this campaign on July 10th. Till August 10th, we have 1 month, and we want to cover about 10,000. I'm sorry, 100,000, not 10,000, 100,000, 1 lakh people all over India. And the campaign has already started. All the doctors all over the country are already starting to examine the feet. It's not that doctors are not examining the feet, but the doctors themselves are doing the foot examination. We see the photographs, and many of the photographs coming from all over India. So the doctors themselves checking the feet will give a right message to the patient that the doctor is not only looking at my blood pressure but also looking at my feet. So the campaign will lead to one, it will lead to increased awareness about diabetic foot in addition to diabetes. And secondly, we will have data from all over India for the first time in the world. I think this sort of campaign has not happened anywhere in the world. So we will have data from 100,000 patients, 1 lakh patients, about how many have loss of sensation, how many do not have lack of sensation, and so on. So I think it's a very important campaign for RSNDA after the Defeat Diabetes campaign last year, which was also successful. We hope that this is also going to be a successful campaign. Thank you, Dr. Sahay. So I think the next question I'm going to ask Dr. Ghanshyam Goyal. Uh, can you tell the importance of foot examination in people with diabetes? We have talked about foot examination as being a part of the campaign. Can you tell the importance of the foot exam? We know blood pressure is important. We know eye examination is important. We know kidney creatinine is important. But we also must give importance to foot exam. So in Hindi, can you tell the examination?
या या थैंक यू डॉक्टर विजय। फुट एग्जामिनेशन बहुत ही इम्पोर्टेंट पार्ट है डायबिटिक्स के अंदर। मैं हमेशा जब भी कहीं पे डायबिटीज फुट के बारे में बात करता हूँ तो आई जस्ट टॉक, यू स्टार्ट योर एग्जामिनेशन अपर द मस्तक, मीन्स यू स्टार्ट योर एग्जामिनेशन फुट टू हेड, नॉट फ्रॉम हेड टू फुट एज वी डू इन आवर क्लिनिकल प्रैक्टिस। सो बाय दैट ये करने से आप क्या है कि पैर का एग्जामिनेशन करना आप भूलेंगे नहीं। क्यों कि diabetic foot complication is one of the most dreaded complication of diabetes and one of the costliest complication of diabetes. And in India, as Dr. Vijay is associated with diabetic foot since more than practically 30 years for this field, that we don't have any amputation registry, but probably more than a lakh of amputation occurs in India every year, and more than 1 million amputation across the globe. So always do start your examination from foot to head, means अपदमस्तक संस्कृत में आपको वहां से स्टार्ट करना है। और क्या क्या देखना होता है, आप प्लांटर स्किन को देख रहे हैं, डॉर्सम की स्किन को देख रहे हैं, इंटरडिजिटल माइकोसिस के लिए आप दोनों अंगुलियों के बीच में यू हैव टू चेक इन बिटवीन द इंटरडिजिटल स्पेसेस फॉर द इंटरडिजिटल माइकोसिस, एंड यू हैव टू लुक फॉर द नेल्स में कोई प्रॉब्लम तो नहीं है। और उसके बाद में आपको पल्सेस दोनों पल्पेबल हैं या नहीं है। अगर पल्सेस पल्पेबल नहीं है तो इसका मतलब ये है कि यू हैव गॉट सम प्रॉब्लम ऑफ सर्कुलेशन, मीन्स यू हैव गॉट peripheral arterial disease or peripheral vascular disease. If it is feeble or not palpable, then if it is palpable, then it means circulation normal है, or if it is bounding means patient is having neuropathy. So this is a very very important aspect. दूसरा फिर जैसा कि Dr. Vijay have explained in detail regarding the RSSDI Save the Feet Keep Walking campaign. In that we have to do a monofilament test. So monofilament test में great toy, first and fifth empty head on both sides, and how to do here put a fantastic video and very simple, very easy. कोई भी व्यक्ति देखने के बाद easily, even paramedics can be trained and easily they can be done, it can be done. So वो करने से and you can identify कि कौन पेशेंट हाई रिस्क पेशेंट है जिनको फ्यूचर में डायबिटिक फुट का प्रॉब्लम हो सकता है, माइट हैव some ulcer or minor amputations or major amputation. इसीलिए to examine the comprehensive foot examination साल में एक बार करने से every yearly you have to do it, and you avoid the amputations and the further complications of diabetic foot. और अगर हाई रिस्क है कैटेगरी 1 तो every 6 months, if it is high risk category 2 every 3 months, if it's high risk category 1 3 then every month. So ये examination से this is the biggest advantage, और ये करते रहने से पेशेंट को आगे फ्यूचर में कॉम्प्लिकेशंस होने का चांस कम हो जाएगा, दैट इज देयर। सो थैंक यू। अभी मेरा क्वेश्चन है डॉक्टर राकेश साहे से, diabetic foot infection is often neglected by patients and they present very late. What is your opinion? As I have discussed in the beginning that they are taking very lightly ना, एक छोटा सा फुंसी हुआ या घाव हुआ एक टू, so what is his opinion and how to tackle that? Yes, Professor Sahay, please.
Yeah, thank you, Dr. Ghanshyam, for the question. But before I answer that question, I would like to just add to what Dr. Ghanshyam Goyal has said. He has said he has focused on what doctors will be doing when the patient comes to, when you go to a doctor, what he would be seeing. But what I want to add is that every person with diabetes should take care of his feet, should examine his feet
Yes.
every day, should see that he washes the feet. I mean, आपके चेहरे की जैसे आप देखभाल कर रहे हैं, आपके पैरों को भी आप उसी तरह से देखना है। आपको ये जरूरी है कि जो है आप रोज आपके पैर धोएं, पैर धो के आप जो है आप एक आईना रखें जिसमें आप पैरों को देखें, क्योंकि आप पैर को आप जैसा आप चेहरे को आप खुद नहीं देख सकते हैं बिना आईने के, वैसे ही जो है आपके पैर भी ऐसे, पैर में कुछ ऐसे हिस्से हैं जो आप देख नहीं सकते हैं। तो इसीलिए आप एक आईना रखिए, जो आईने पे आप आईने आईने के अंदर आप पैर को देखिए आपके। और क्योंकि कई बार ये होता है कि आपको थोड़ा सा सुनपन रहता है, बराबर से सेंसेशन नहीं रहने से आपको पता नहीं चलता है कि कहीं कुछ लग गया है, कुछ चोट लग गई है, कुछ घाव हो गया है, कुछ चुभ गया है, तो आपको पता नहीं चलेगा। तो इसीलिए आपको ज़रूरी है कि आप रोज़ पैरों को धोएं, और आप पैर को आप एक आईने में देखें, और जैसा आप चेहरा देख रहे हैं वैसा देखना है। दूसरी चीज़ ये है, अब ये इन्फेक्शन के बारे में जैसा घनश्याम जी पूछे हैं, तो इन्फेक्शंस इसी वजह से होते हैं कि जो है आपको थोड़ा सा सेंसेशन कम होने की वजह से, कुछ अगर कोई चोट लग जाती है पता नहीं चलता है। उसके ऊपर से जो है ये कि रक्त प्रवाह में, मतलब ये जो ब्लड सर्कुलेशन भी थोड़ा सा कम हो जाता है डायबिटीज़ की वजह से। और तीसरी चीज़ ये है कि जब डायबिटीज़ ब्लड शुगर कंट्रोल में नहीं रहती है ना, तो जो शरीर का जो इन्फेक्शन को टैकल करने के जो इम्यूनिटी रहती है थोड़ी सी कम हो जाती है। तो उसके वजह से ये होता है कि इन्फेक्शंस बढ़ जाते हैं, मतलब जो नॉर्मली जो इन्फेक्शन अपने आप में कम हो जाना चाहिए या नहीं, को ये नहीं तो कोई थोड़ी सी छोटी दवाई वगैरह मतलब से कम हो जाना चाहिए, वो कम नहीं होते जल्दी। तो इसीलिए डायबिटीज़ फुट मतलब ये नहीं कि जो पैरों में जो घाव होते हैं, जो उसमें इन्फेक्शन होने के चांसेस बढ़ जाते हैं। और इन्फेक्शन कब कैसा पता चलता है आपको, कोई सूजन हो, या कोई लालपन हो, या कोई दर्द हो, तो ये सब चीज़ों से आपको इन्फेक्शन का सस्पिशन रहना चाहिए, और आपके डॉक्टर को आप तुरंत कंसल्ट करना चाहिए कि आपको दवाई की ज़रूरत पड़ेगी, इन्फेक्शंस के लिए दवाई की ज़रूरत पड़ेगी। तो इन्फेक्शंस क्वाइट कॉमन, आई मीन काफ़ी कॉमन है, और इन्फेक्शंस पहचानने में काफ़ी टाइम लग जाता है, क्योंकि ये सुनपन की वजह से इन्फेक्शन के लक्षण भी कम हो जाते हैं। तो इसीलिए इन्फेक्शन ज़्यादा सीवियर हो जाते हैं, और शुगर कंट्रोल अगर बराबर नहीं रहता है तो इन्फेक्शन हीलिंग भी देर हो जाता है, हीलिंग भी स्लो हो जाता है। तो उसकी वजह से जो है वो इन्फेक्शन फैलता है, ऊपर की तरफ फैलने शुरू हो जाता है, और उसकी वजह से आगे चलकर हमें मतलब उसको कई बार आपको जो है प्रॉब्लम ये होता है कि अगर सीवियर इन्फेक्शन हो जाता है, बॉडी में फैल जाता है, तो आपको कई बार एम्पुटेशन भी करना पड़ता है कि इन्फेक्शन को फैलने से रोकने के लिए। तो ये है इम्पोर्टेंस ऑफ अर्ली identification of infections. I would like to ask Dr. Vijay, because I have just told about amputation, how infections can spread and can be a deterring factor for amputation. What are all the factors that can actually predispose a foot towards going for amputations? How can we prevent those? What are the factors? Can you tell us more?
Thank you, Professor Sahay. I think since the public are also listening to this, apart from doctors, I would like to say only two things. One is when a person enters the clinic, when a person enters the clinic, as Dr. Ghanshyam said, you should examine the feet. There are two things which can go wrong in the feet. One is the blood circulation can be reduced and you can be not knowing about it. Number two, the sensation could be reduced in the feet, just like in leprosy, the hands, the sensation goes down. So, unless you are examined by the doctor or by the foot care person who is in charge of the foot care department, and we don't need expensive 1 lakh, 5 lakhs, 10 lakhs machines. We need only one small monofilament or a tuning fork is there, which the doctor has. So you can examine for loss of sensation. Number one, loss of sensation. Number two, just have to feel the pulse, just as you feel the pulse in the hand, radial pulse. You feel the pulse whether the person is alive or not. Similarly, you can feel the pulse in the foot, here in the foot. So you can examine the foot pulses. There are two pulses which are available in the foot. You can examine it. So two things are very important. One is look at the blood circulation, and two, see if the sensation is normal. These two things are very, very important. So this is for the information of patients, people with diabetes, because any patient who goes to a doctor should ask the doctor, is my sensation okay in the feet? Number one. Number two, is my blood flow to the feet okay? Two questions every patient must ask the doctor. These are the two factors, which main factors in India, which lead to amputation. All the other things, heel fissures, deformed nails, cannot lead to an amputation unless you have this loss of sensation and loss of blood supply, two things. So this is the most important preventable factors which every doctor must examine and every patient must find out. Patients ask, doctor, is my diabetes under control? Next time the patient should ask the doctor, doctor, is my sensation normal in the feet? Doctor, is my blood flow to the feet normal? This is the two questions which every patient should ask the doctor. The doctor will examine, that's a different point, but every patient should ask the thing. So, thank you, Dr. Sahay, Professor Sahay. I think these are two major factors which we need to address. And if you address these two, then the amputation prevention becomes very easy. Dr. Ghanshyam, diabetes control is very, very important for preventing all complications. How important do you think is diabetes control in preventing food complication? Is it important? Is it important to control diabetes before you get food complications? Can you highlight and tell us the importance of blood sugar control?
Thank you, Dr. Vijay. As Dr. Vijay explained in detail regarding the neuropathy and peripheral arterial disease, as we all know, अगर शुगर कंट्रोल अच्छा नहीं होगा तो डिफरेंट स्टडीज हैव प्रूव्ड इट कि इंसिडेंस ऑफ न्यूरोपैथी काफ़ी ज़्यादा इंक्रीज हो जाता है, जैसे कि जो डिफरेंट ट्रायल्स में हैं, जो ओल्ड ट्रायल्स हैं यूकेपीडीएस या डीसीसीटी जो टाइप 1, in that situation and in the newer trials also, it has been shown if the blood sugar control is poor, incidence of neuropathy increases. So this is very important. And second, about the peripheral vascular disease also, and अगर शुगर कंट्रोल अच्छा नहीं है, if A1C is more than 7 or without producing hypoglycemia 6.5, but definitely if more than 7.5, जो कि हम लोग हमारे क्लिनिकल प्रैक्टिस में आप सभी लोग देखते हैं कि whenever these diabetic foot patients are coming, most of the patients are in very poor glycemic control. I'm yet to see a patient who is in good glycemic control. अगर उनको गुड ग्लाइसेमिक कंट्रोल होता है और अगर उनको किसी तरह से कोई चोट लगी है या कुछ हुआ है उसी की वजह से उनको घाव होगा, अदरवाइज having loss of protective sensation with good diabetic glycemic control is unusual. So diabetes control is very very important. ज़्यादातर पेशेंट्स में जो कि लॉन्ग स्टैंडिंग डायबिटीज है, दे आर सपोज टू बी पुट ऑन इंसुलिन. इफ दे आर shorter duration of diabetes or diabetes of less than 5 years, I can say that we can continue with the oral drugs, and if they are maintaining a A1C of less than 7 or 6.5, it's okay. But if it is more than that, then definitely we have to go. As Vijay this particularly mentioned, or Professor Sahay particularly mentioned regarding the other complication, all microvascular and macrovascular complications, तो सभी कॉम्प्लिकेशन की तरह ही इसमें भी न्यूरोपैथी में भी वेरी इंपॉर्टेंट है डायबिटीज कंट्रोल, ऑफ कोर्स ब्लड प्रेशर कंट्रोल, लिपिड कंट्रोल, quit smoking, and the other risk factors to be avoided or to be make. So that is very important in the management of diabetic food. तो मेरा क्वेश्चन है प्रोफेसर साहे से. प्रोफेसर साहे, does cigarette smoking play an important role in diabetic foot complications? What is your opinion regarding this particular issue?
Yeah. So just now, Dr. Ghanshyam was telling about diabetes control, and he also mentioned about cigarette smoking. So cigarette smoking is actually what it does is that it causes narrowing of the blood vessels everywhere. So जो रक्त प्रवाह होना है पैरों में और कहीं भी, मतलब हर टिश्यू में, the blood supply becomes lesser with cigarette smoking. Cigarette smoking contains nicotine and other substances which can cause vasoconstriction, यानी कि blood supply कम हो जाती है, तो इसीलिए heart attacks are increased. Similarly, even in people without diabetes, what happens is that cigarette smoking causes amputations, causes Burgers disease नाम की एक बीमारी होती है जिसकी वजह से पैरों में रक्त प्रवाह कम हो जाता है. और अब जब डायबिटीज भी ऐड हो जाता है तो वो और बढ़ जाता है. तो सिगरेट स्मोकिंग का असर डायबिटिक्स में बहुत ज़्यादा होता है और इसकी वजह से नॉट ओनली हार्ट अटैक्स भी हो सकते हैं, बट पैरों में भी अल्सर, मतलब जैसा जो ब्लड सप्लाई इफेक्ट होती है. जैसा अभी we have been discussing that blood supply is very important just as much as the protective sensation is important. So this blood supply is affected by cigarette smoking, and because of that, cigarette smoking is one factor which is very much in the hands of the person, and it is for him to decide that this is not good for him, and he has to decide and stop at once immediately without trying to reduce it. What we have seen is that people who try to reduce the number of cigarettes will never be able to stop. They have to stop it, decide about it, understand the importance of stopping, quitting smoking, and quit it at one time. That is my experience with all those who stop smoking versus those who just attempt and are not able to stop. So that is one important thing that I would like to say. And another important thing that we should be discussing today is about the type of footwear we are wearing. We are saying that barefoot walking causes ulcers, causes problems, causes starts off this foot problems. So it is very important, and sometimes the footwear is also a problem. While we are saying footwear is protective, sometimes footwear can be a problem, because if the footwear is not properly designed, it can actually start off ulcers because of that only. So to tell us about that in detail, I would ask Dr. Vijay to tell us more about this. How important is footwear in preventing the foot complications? Uh,
So thank you, Professor Sahay. I think the footwear plays a very important role. But when you say footwear, people have all sorts of thoughts. Let me tell you, because this is being listened to by patients also. 70% of people with diabetes do not require any special footwear. 70%. Only 30% need what is called customized insole. I will tell you about customized insole in a minute. Now, when I say 70% do not require any footwear, special footwear, there are some characteristics of a good footwear for people with neuropathy, loss of sensation. One is the toe box. The front part should be broad, it should not be pointed. Like some people wear shoes which are pointed shoes. No, not allowed. It should have a counter at the back, like a shoe counter, number two. So, one, the toe box should be wide. Two, the counter should be there, like a shoe. Third, the outer sole should be rigid. It should not be soft. You should not be able to bend the footwear. If you take a footwear in your hand, shoe or footwear, sandal, you should not be able to bend it. So the classic example of a good footwear is the sports shoe, which we all have. Sports shoe. I'm not naming any brands. You can take any brand. Uh, a good sports shoe you take in your hand, it will have a broad toe box. It will have a counter. It will not bend. The outer sole will not bend. So these are all the character, and the insole should be soft. So that's also in the sports shoe. You see the insole will be very soft. So it will redistribute the pressure. So this is what is needed by 70%. 30% of people have one toe which is missing, amputated, or they have limited joint mobility and so on. They need customized insole. We have machines in India available which can make customized insole. 30% need it. People who get repeated ulcer in the under the first metatarsal head, they need customized insole. They can't be wearing any sandal which you can get from the shops. So I think 70% need good sensible footwear. 30% who have repeated ulcer or deformity and so on need customized insole. Insole should be customized. Like I give this example of a shirt. You can buy a ready-made shirt, or you can go and buy the cloth and the tailor will cut it for you. That's customized tailoring. So if you can't fit, if your shirt fits here, doesn't fit here, you have to take the cloth and stitch it. The tailor will stitch it for you. That's customized. That's needed in 30%. 70% of people need only sports shoes, any good sandal which adheres to the sports shoe concept. Thank you, Dr. Sahay. I
and I
think
would,
we have,
yes,
yeah.
I think I should also just add that you wear the footwear and see, because many times when it is tight, it can cause a bite from the shoe can actually start off a ulcer and start off a problem. And also people who have some swelling in the feet, maybe taking it in the evening, going in the evening and taking a footwear is maybe
Very
preferred,
important.
because then that's the time when the foot is slightly bigger, and you don't
So
want to take a small size and end up with a problem. So I think these small points, I think we should all keep in mind and see that we protect our feet.
I think we have come to the end of a very good discussion, and we had some good comment also just now from somebody that talked about it. So first, I'll start with Dr. Ghanshyam Goyal. What would be your final message for the public and for the doctors?
very important. Professor Sahay already mentioned. You treat your feet as you treat your face. This is one. Second, never walk bare feet. And third, very very important, which I mentioned, apadamastak. Start your examination from feet to head. So you are not going to miss the foot examination, and by that only doing or ask each and every patient of diabetes to remove the shoes and socks and examine the feet to prevent the amputations.
Thank you, Dr. Goyal. I think you gave some really good points, and I'm sure that the public and the doctors who are listening will learn from your wisdom. And the final message you gave was very good. Professor Sahay, what would be your final message?
Yeah, I think Dr. Ghanshyam has summarized it very well. I would just like to add, tell people, take care of your feet. They will take care of you, and they will make you go far. You can walk far further if you keep taking care of, you take care of your feet well.
As far as my message is concerned, I think you should support the RSSDI campaign, Save the Feet and Keep Walking. We have a very ambitious target of screening 1,100,000 patients in 1 month. So it's a very ambitious target, but it's for the first time in the world, I think we are attempting this. So I
Yes.
think on behalf of RSSDI, I would like to thank Dr. Ghanshyam Goyal and Professor Sahay for your enlightening talk and points. And we will meet very soon again. We have a series of programs going on diabetic foot. So in different languages also. Tomorrow is Haryana, day after tomorrow is Tamil, yesterday was Telugu, and day before yesterday was Kannada. So we have in different languages. Bengali also will come up, but well, so
Yeah,
don't
yeah.
mind. So Bengali also will come up. So thank you very much, and I'd like to thank RSJ for this opportunity. Thank you.
Thank you,
You
Thank
Dr.
you.
can
Vijay. Thank
you
you.
can
Thank
stay
you.
on.
Thank you
We'll
all.
go on. Yeah, just stay online.